According to Nadia Wan, the CEO of Thomson Hospital Kota Damansara, the COVID-19 pandemic had exposed the acute shortage of health resources in Malaysia, from medical items to capacity and talent. Speaking at a virtual forum hosted by Sunway Project for Asian and International Relations, she said the issue raised a bigger question as to how the country could build the resilience of its healthcare system. Nadia said, early on in the pandemic, there were issues in terms of local supply of personal protective equipment. Now, we are very aware of the shortage of vaccines being delivered to Malaysia because we do not have domestic capacity to manufacture vaccines. Even in simple things like building labs, there is a capacity strain, not just in terms of buying the equipment, but more importantly, the resources to build and run the lab, she said when speaking on the theme Pandanomics, Global Economic Sentiment to COVID-19. She said Malaysia had also been facing a brain drain of doctors and nurses for some time. You can see this when people question why the health ministry doesn't increase intensive care unit capacity. She said ICU capacity was not only about beds, but the people who run the ICU. You can't manufacture this overnight. Nadia said the pandemic raised questions of crisis management and response, and the legal framework that health authorities needed to deal with during a crisis. Often, the health ministry has to rely on emergency ordinances to push things through in terms of procurement. However, Nadia said the pandemic brought the public and private health systems closer together and brought digitalization of healthcare to the fore.